Hi, listeners. A brief note. This is the same batch of recordings as our first show, which had some sound issues. So, just to warn you up front, thank you for your patience. We hope that you do enjoy this episode of Living Large in America.
And I don't recommend this for everybody. It's just what worked for me.
Look, I don't do public shaming.
We were just this lovely, plump family.
You have to live life right now.
Hi, and welcome to Living Large in America. I am your host, Lisa Quintana, and today I am joined by Jennifer Hudgens, a writer and educator from Oklahoma City. Hi, Jen.
Hello.
How you doing?
I'm doing great. How are you?
I'm doing fabulously. How cold is it there?
It's not actually. It's kind of nice outside. I want to say it's like going to be probably in the 60s today, so it's actually really decent. We might go to the lake or something later.
Let's talk about you and weight and
Yes.
meds.
Yes.
So this is a story I've actually heard from quite a few people, and in fact, there are important people in my life who are on meds that are suddenly making them starving all the time.
Mm-hmm.
And this is not a phenomenon that I had run into before. Like a lot of women, I was on hormonal birth control pills when I was in my 20s and early 30s, and that made me gain weight, but it wasn't like a lot. It was like 10 or 15 pounds. The rest I did on my own. The notion that people are gaining not just a little weight, but a lot of weight because of meds is kind of scary. So what happened?
Well, I'm going to backtrack a little bit. In 2015 to 2016, I got diagnosed with fibromyalgia and two kinds of arthritis. And so they put me on medication because I have severe neuropathy. And for those who don't know, like neuropathy is, it just like pins and needles, your clothes hurt, anybody touching you, the air touching you can be painful, and it's excruciating. And literally anything, the air, taking a shower hurts, but I had episodes and I didn't realize that was what it was until later on. Well, they put me on something called gabapentin and to try to help with the pain and stuff, and it helped, but I was on 1,800 milligrams of that. I started to tack on weight. I started to get where I just was so tired all the time. And that's a problem too with like, the anxiety meds I've been on as well. And when you take that stuff, like it's supposed to make things better, but really, honestly, I've lost weight unintentionally, just quitting taking things that were making me more sedentary and me more stuck. I also got on some anxiety meds around that same time because some other stuff was going on, like my dad passed away and stuff. But with that, because originally in 2009, I had a gastric bypass and I had lost over 300 pounds. I maintained that weight loss for a long time. And then, around all that time when, my diagnoses were happening and everything was happening, once I started the meds, I started to tack on a lot of weight. And I got back up to, I was almost 500 pounds originally. I got down to 186 and kind of teetered in around 195 to 220, depending on, the year. But
how tall
kind
are
of
you?
stayed in that. I am 5'5".
Okay.
And a half. But that half is really important. And I have really, like, my bone structure is really small. Like, my legs are small, my arms are not big. So it's mostly just weight in the middle. But tacking all that weight on made me more tired and my arthritis more exacerbated and things like that. Well, and I don't recommend this for everybody. It's just what worked for me. But getting myself off of those meds was really helpful just because I'm back down to like, I think I'm down to 262 now, and I had gotten back up to, I was almost at 400 pounds again. And so over the last year or so, I've just gradually lost weight unintentionally. It kind of just happened. But I noticed on those meds and some other meds, like I was on Plaquenil for the arthritis pain and inflammation. That had a whole slew of side effects, also causing problems with my kidneys, my stomach, and like linking to anemia that I ended up having too. So, I ended up getting off all of that, which again, I don't recommend to everyone, but I have dropped, just since I quit taking a lot of those meds, I've dropped a substantial amount of weight. I've lost like around 100 pounds in like a year and a half, just unintentionally.
Wow.
Cause I'm not eating like excessively. I don't feel the need to go snack and do all those things, as much. And like I said before, and I have no problem saying this, like, now, I have a medical marijuana card, and I will eat edibles like to sleep. Well, it helps with the pain a little bit so I can sleep and stuff like that. I don't get the munchies the same way, or like occasionally, but I don't get hungry or the munchies or like that urge to eat as frequently as I did when I was taking just stuff for anti-anxiety, and like anti-inflammatories. So it's really strange how that works. I don't really understand. I guess maybe it's the brain receptors that the medications appeal to. Maybe I'm not really sure, because I'm not a doctor. I think that correlation really needs to be investigated a lot more, because most of the people I know that have taken anything for like pain, inflammation, or anxiety or depression, primarily, they do put on weight most of the time, or they go the opposite where they drop weight. I know I took Zoloft at one time and I had literally no appetite for months, and I dropped a decent amount of weight just because I wasn't eating. So it's been, kind of a back and forth battle with that stuff.
When you got a gastric bypass, what was your primary motivation? Because, having now gone through gastric surgery myself, it is not a small step. And if you have to go through insurance to get it, you got to jump through a lot of hoops for that. So,
Yep.
So what was your motivation for doing that?
Well, I had, been overweight for a large percentage of my life and dealt with like, eating disorder stuff, due to childhood trauma. But, when I was 14, I had a major surgery, a ovarian cyst rupture, and I almost died. And I was at 122 at that time, and I was under 5 feet tall. So I was a little chubby, but not, heavy. And then by the time, and that was 14, by the time I graduated high school, I was almost 500 pounds, because of all the surgery, the trauma, the hormonal imbalance and stuff like that. Well, I struggled with weight issues on and off for years. Well, and then, 2009, you're right, with insurance, you do have to jump through hoops. I did have insurance at the time that paid for it. My motivation was I didn't want to be like one of my aunts who died pretty young, because she was heavy and had a lot of health issues. And, I was like, I don't have diabetes right now. I don't have high blood pressure right now, but I could drop dead at any second because my body's not built to carry this weight. But it was because I was like having a hard time. Like I'm asthmatic, so I struggle with some of that. And it's something I've always had issues with. But honestly, the only real health problems I had at that point, I had sleep apnea and asthma. I wasn't on any medications for anything else. And it surprised the doctors, but I didn't want to be fat anymore. I didn't want to die. And I felt like that was my only option. And it is such a tough thing. And people think it's the easy way out.
Oh my God.
And you know what I mean, because people will be like, oh, well, instead of exercising and all this other stuff, you did this. And I'm like, here's the thing. I think that surgery is extreme, and I think that it's shopped around way too easily. And I have a lot of opinions about it, and I don't know that I would have done it again if I knew then what I know now. But that doesn't mean it's not going to work for some people. I mean, obviously it worked for me in part, but I just really I was tired of living in that shell and wall that I had created, and trying to I tried diets, I tried exercising, and I just couldn't lose a lot of the weight. But I later realized after going through all of that stuff, the surgery, and you probably get this, hormones, it took me like 4 years or more for my hormones to get figured out and adjusted. It was so bad because I lost like the 300 pounds in like a year. I lost it, or a little bit less than that. And so it just was so fast. Well, I kind of like realize now that it was, the weight was more of a psychological and trauma thing than it was about food. I really honestly wish that someone would have found me or helped me find a good therapist when I was, 10, and curb all the eating disorder stuff before it got to that point. Cause, I don't think this for everybody, but for me, having the gastric bypass ended up being just another way for me to try to gain control over my body. And it to me, I don't think I should have been necessarily allowed to do it, because like I saw a shrink one time for insurance, and she goes, "Do you think you're ready for this?" And I said, "Sure." And she signed off on it.
Wow.
Didn't talk to me. Yeah, it didn't really talk to me about anything in depth. And that was like literally, people were going in like constantly. There were so many people in that doctor's office. It was like a fucking vending machine. And since then I've had so many health problems, because of it, that I don't know whether to attribute those to something else, old age, cause I'm 41 now, or because of the gastric bypass. Cause like, I don't get nutrients the way most people do. I can't eat a lot of things that people do. I can pick at things. If I eat too much, I get sick, or I get shaky and pass out. I have things that like make me look like I'm diabetic. I can't eat ice cream, but I'm not diabetic, so there's so many things, constant like issues with my stomach, digestion, all sorts of stuff that is just sucks, that I deal with on a consistent basis because of the surgery.
So this is really surprising, and I think this is important for people to hear, that even after you had a gastric bypass, which severely curtails your ability to take in calories, it is a good day for me when I get 700 calories in a day. I am doing great that day. That is not my norm. My norm is usually between 500 and 600. But because you're on all these medications, you were still gaining weight. What that says is that the physiological factors behind gaining weight are not the really simple math of you have to expend more calories than you take in. That is not true. I
think that people need to understand, and this is true for everyone, that 97 plus percentile people that get bariatric surgery or go on a diet, that weight loss is not permanent. And they don't tell people that. They don't say you have a 5% chance of this remaining successful the rest of your life. But because the problem is people they go get the surgery, but they're not put into therapy after that to teach them how to have better coping mechanisms, to teach them how to deal with food in a different way, to have a healthy relationship with themselves and their bodies. I mean, at the end of the day, you got to do what's best for what is, best for you and best for your body. And I should be eating salads instead of eating crackers or cookies. I don't eat a lot of cookies, but you know what I mean? But also not shaming yourself when you do those things. You can be healthy without having to diet.
What is the largest number of medications you've been on at one time?
Probably 8.
Wow.
Yeah.
And what kind of a relationship do you have with your pharmacist? Because I know that I live in a tiny, tiny little town. So I am lucky in that my pharmacist, I don't even have to tell her my name when I come in to pick up a prescription. She knows who I am. So she is way more likely to say, I see that you have this medication from this physician and this medication from this physician. You shouldn't be taking those both at the same time. Maybe you should take one at bedtime and one when you wake up, or, she's really good about counseling me about how my medications are working together. So did you, were all of your medications playing nice together, or did you not ever get that kind of counseling?
I never got that, to be honest. And the problem, I had a good pharmacist, or a couple of pharmacists now. I go to, there's a clinic at Oklahoma State University that I get student health insurance through because I'm in grad school. They want us to be healthy. And so I go through them, and they're pretty good stuff, but, they will try something, and if it doesn't work, they're really open. They also, I really love this clinic for a lot of reasons because they listen to me. They don't automatically go, oh, well, you don't feel good. It must be because you're fat. That is a problem that I've had with a lot of other physicians, and they know that I've had trauma. So when I go to the female clinic there, to get checked up, they are really careful about things. They ask me questions, tell me what they're going to do, and they're really good across the board there. When I was taking several things at a time, they've kind of said, hey, this has this side effect, blah, 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 but not super in depth. But I do my own research because I used to be a pharmacy technician back in the day. And, I know that doctors don't know as much about the drugs as pharmacists do. And I can find more research online than a doctor would probably necessarily know. Cause they don't have continuing education the way that pharmacies do. And so I do my research, and that's why part of the reason I quit taking Plaquenil, because I found out that it could cause issues with your kidneys shutting down, as well as it could have attributed to the anemia thing. I don't know what caused anemia, to be honest. I don't have a for sure instance of that. All I know is that right now my iron levels are okay. But yeah, med-wise, I've taken so many different things, and not once did they question any pharmacy that I went to when I was taking the gabapentin at 1,800 milligrams, which is a dose that is so heavy. I could barely walk. I was so droopy and tired. I sprained both of my ankles within 2 weeks of each other because I couldn't walk. People thought I was drunk all the time.
Wow.
And pharmacists never questioned that. They're like, we'll just give you this and this huge bottle of this stuff. And it was great for the neuropathy because I didn't feel anything. But people thought I was drunk because I was tripping over my own feet all the time. And I was like, I don't even drink right now. So
what was all of this doing to sort of your self-image and your sense of self-worth?
Oh, I didn't really have any. I was too busy being tired and depressed and even on, because the thing with gabapentin is it caused me, and I've had issues with a few other drugs related for fibro and stuff, and neuropathy causes night terrors, sleep paralysis, all sorts of weird stuff that just scared me. But it was really, I was just exhausted, to be honest. And I did my undergrad degree around this time also. So I was really tired dealing with that, my health issues, grieving the loss of my father, all kind of at the same time. And so it was really a lot. So I couldn't pinpoint any one thing, but I was just exhausted. I just didn't want to hurt anymore, and I didn't want to be so tired anymore. I wanted to feel like a normal person. And I don't really know what that means anymore, but
yeah, I find it so interesting that there are so many drugs whose side effect is weight gain. And it seems so ironic to me that people are taking drugs to make them feel better, and maybe, along one axis, physically they feel better, but then emotionally they feel like shit because now they're gaining weight, or they, have no motivation or whatever. And I don't feel like these kinds of costs are well described enough to patients before they take this medication.
No, absolutely not. And I think that, and that's part of the reason I quit working in pharmacy, is because people come in and they're like, oh, I thought I was healthy as a horse, and here are 5 prescriptions of stuff that I didn't even know was wrong with me. And I'm an avid believer that if you think something's wrong with your health, go try to get it taken care of if you can. If you don't have the access, there are ways, and some people don't have access, which sucks, and I'm lucky that I have some insurance right now, which I didn't for a long time, but they don't educate people enough on the side effects of drugs, and they just say, oh, well, here's this drug that's supposed to help this one thing, but hey, you get, and that's why the commercials, they rattle off 30 different side effects that really are worse kind of than not taking anything at all.
I feel like one of them is always death. So yeah, your osteoarthritis might improve, but you're gonna die. I don't know if that's worth it.
Yeah, and a lot of the drugs that they give for people with RA, and this is something that I've avoided, is injectables, because it actually makes your immune system worse. It helps the pain, but it makes your immune system worse. And I'm like, it already takes me a while to recover from being sick. I don't need any help with that. And so I look at it this where it's like, I think people should be educated better. I think doctors and pharmacists should all be educated on a constant basis and be required by law to do that, and not, say, hey, we could look at this, and if you want to try medication, that's fine. We can also try this. We can try this, and give them like a more holistic approach than just like, and I'm not like an anti-vax or anti-meds at all, because meds have, at one point, the anti-anxiety meds I was on saved my life because I had some issues. As a whole, I feel like people do need to understand what they're signing up for when they sign up to get on these meds. And a lot of times with the anti-anxiety meds too, you can't quit cold turkey on that stuff. You can't quit cold turkey on most of it because you have withdrawal symptoms. Every drug I've been on for anxiety, every depression, anything I've been on for my neuropathy and fibromyalgia and stuff, I've literally had such bad withdrawal symptoms that I was so violently ill, like I couldn't move for days. And that sucks because they don't tell you this is something that could happen. They don't say, hey, you probably shouldn't stop taking this. Hey, you need to wean yourself off of it. But in the long run, for me, a lot of those meds were making me feel sicker than when I was not on anything. And I want to keep going back to that because I do think meds work for some people that do absolutely need them. I used to be ashamed to talk about like my eating disorders, and now I'm just like, if people want to talk about it, cool. Not everybody wants to hear about it, but I think that it's important for me and important for other people that have been through similar things or are going through similar things, that like, just because you don't fit into a box that the society wants to fit you in doesn't mean there's anything necessarily inherently wrong with you. It's just, hey, this is who I am right now. This is my body right now. And like, I have good days and bad days. Like a couple of days ago, I was not doing super great for whatever reason. 'Cause I have, again, anxiety, monkey thoughts and all that. But at the end of the day, like, I think I'm doing pretty well as a human being right now. It's instead of like torturing ourselves over things that we either don't have control over, or we do when we just aren't ready to change yet, like making ourselves feel worse about those things, it's not productive. It doesn't really get us anywhere. And like, at the end of the day, either we're going to change as people or we're going to grow as people and become healthier, like in those like ways to cope and whatnot, or we're not.
And if you're stuck, no amount of people guilting you or shaming you from the outside is going to help you get unstuck.
And I'm really bad about that. Like I have a huge problem, and I've been discussing this at length with people that I currently live with, that, I need to stop caring so much about what other people think of me, because that's been so detrimental. Because again, I am a people pleaser. Like I grew up where I was so worried that I was not worthy of people's affection or love, and I still feel that a lot of times. Like I have horrible trust issues when it comes to that stuff, because I don't know if people are genuine or not. Like I want to believe that they are, but I still also think, okay, people are just tolerating me because of what they can get out of me. And any second at the drop of the hat, I'm going to like not be good enough and not be worthy enough for, the love or whatever. And so I need to stop thinking, okay, well, my life and my success and who I am as a person and my validity should not rest in the eyes or the speech of someone else. It shouldn't be up to someone else to tell me how to feel about myself. And so I'm still trying to figure all of that out. And I probably will be figuring that out, at least in some aspect, until the day that I croak.
Oh, that makes me feel so sad, because I love you, and I feel like, I do feel like other people can't tell you how to feel about yourself, but it can be really encouraging to hear other people saying that they feel good things about you.
Yeah, and it helps, but at the same time, I always have that like in the back of my head, like, are they really just putting up with me, or because like in my head, it's like I still have, I nitpick at myself more than I nitpick at anybody else. But again, it goes back to the ability to feel worthy and like the shame aspect and stuff like that, and and still trying to deal with like learning how to cope and be an actual adult human being. And that's something I didn't get a lot of lessons on, so it's actually making me a little bit more cognizant. I'm trying to be more mindful of the way that I talk about myself. But again, still work in progress, of course.
Well, and it's also helpful to remember that human beings have big, complex minds that can hold many, many competing thoughts at the same time. So it is possible for somebody to both think that you are a wonderful, deserving, and worthy human being, and also think that you're fucking up right now and you need to straighten your shit out.
Right. And that's what I like. And that's what I like about it, one of the things that really bothered me about after I had my gastric bypass, and this is a huge issue for me, that I had surgery, and I never thought I was an ugly person until other people told me they thought I was. And I've had issues with that.
Who the hell told you that? You're hella cute.
Like a lot of people, but like especially when I was heavier, and guys who were like, oh, I don't want to date you, but I'll sleep with you and tell no one. But when I had my gastric bypass and I lost all that weight, there are people I'd known for 10 years that are like all of a sudden all over me like white on rice because suddenly they think I'm attractive because I'd lost all that weight. And I'm like, I'm still the same fucking person. Like, I thought I was pretty cute. Like, and that's the thing is, like, people want to play that they're concerned about your health and stuff. And that's another thing I have issue with, because after I had my gastric, to be honest, I still was really controlling of my shit. Once I lost all that weight, I wanted to lose more. And I was down to 186 at that point. And I could send you a picture of myself. My cheekbones were really prominent. My collarbone, my face looked caved in. I was literally living on caffeine, cigarettes, and not eating because I couldn't keep food down. And so I was like, well, fine. If I can't eat, I'm just going to lose more weight and, do it this way. And, and of course I plateaued out because that's what happens. Your body just stops because you run out of fat for it to live off of. I don't recommend this to anyone because it's bad. And I smoked on and off. But I think that, it gets to a point where people are like, oh, I'm pretty now. And in my head, oh, I've always wanted to be pretty. So I'm going to just keep losing weight because people think I'm pretty if I lose weight. And so it's that sick part of my brain that goes back to that eating disorder mindset that like, hey, I'm only pretty if I fit. I'm only pretty if I don't take up enough space or too much space. And so now I'm just like, okay, I know I take up space, and I still apologize too much for taking up space. And that's another thing I have issue with, but, and I'm still working on, but it's a matter of like, why can't people just go, you know what? I think you're awesome as a human being. If you're not attracted to me, cool. That's fine. I don't need you to be necessarily. I don't need to, that's not how I survive.
Also, when you compliment somebody on their weight loss and you say, oh, you look good, you have no idea why they lost weight, and therefore you have no idea what you're complimenting. You may be complimenting them on, oh, you look so good since your spouse died and you haven't been able to eat from grief. Oh, you look so good since your stage 4 cancer diagnosis and chemo is eating you alive. You have no idea. Okay, and with that, I think we're going to end things. Thank you so much for hanging out with me. It has been fascinating to hear about your journey.
Thank you. And it's been great talking to you.
And that is our show. If you like this show, please subscribe in Apple Podcasts. We will be up on Stitcher shortly. And we really hope that we see you in 2 short weeks. In the meantime, I really hope that you are all doing okay under quarantine, taking care of yourselves physically, emotionally, spiritually. And if you end up putting on some Kummerspeck, which is the German word for grief bacon, or the weight you gain with emotional eating, well, it happens. And until I talk to you in 2 weeks, please take care of yourselves.